Hello, welcome to the Health Bridge podcast. I am your host, Holly B. Today we are chatting with Dr. Chad Nowlin. Dr. Chad is a pioneering physical therapist and the founder of NRG Physio, which takes a revolutionary approach to physical therapy that emphasizes accurate diagnosis and holistic treatment. With a strong background in anatomy and a passion for improving musculoskeletal health, Chad has developed an innovative evaluation process called the Keystone Reset. This process challenges the traditional physical therapy methods by addressing root cause rather than symptoms and providing comprehensive and lasting relief from chronic pain. Chad works both with individual consumers who maybe have gone through the standard physical therapy or tried other treatments and just haven't seen the results that they're looking for. And he also works with employers by creating more of a employee wellness program so that employers can cut down on their healthcare spending. Dr. Chad is deeply dedicated to his field, and it stems from his belief that everyone just deserves access to superior physical therapy. He's committed to helping individuals and organizations understand the importance of comprehensive musculoskeletal care and really believes in helping people avoid unnecessary surgeries. Dr. Chad offered so many good, valuable insights into where pain comes from, what we need to shift to actually truly make changes. He talks about the limitations of standard physical therapy care versus more of an individualized approach. And we get into topics like understanding that the source of pain and the root cause of that pain can be two completely different things. We talk about understanding patterns of restrictions in your joints and how that impacts muscle tightness or impacts movement and strength. We also get into talking about yoga and how that may or may not be helpful depending on what is going on with your joints. And we also get into a conversation about how do you handle joint pain when you are also dealing with an autoimmune condition and how that might look a little bit different than quote unquote standard physical therapy patient, but how the same principles can apply to you as well and how to go about applying some of these methods into your daily routine in order to help with some pain relief. With all of that, let me go ahead and introduce you now to Dr. Chad. Enjoy the conversation. Dr. Chad, welcome. I can't wait to dive into a really interesting conversation with you today about getting to the root cause of pains and aches and all the things that you deal with in the physical therapy world.
Yeah, absolutely. It's great to be here. Excited to kind of go back and forth with you, see what comes out of the conversation today.
I love that you take a very unique approach to physical therapy. I've been through some different aspects of physical therapy myself, and I'm sure you hear this all the time, but I came through it through my health insurance. And usually when that happens, it seems to be a very structured approach. In other words, you go in for back pain. Say I go in for upper back pain, you get given specific exercises for that back pain. And if I'm in there and I say my hip's really bothering me too, they say, we can't talk about your hip because you're here for your upper back and that's all we can manage.
Yep. Yeah. And there's
Yeah.
multiple reasons for that make healthcare what it is, which is one of the bigger problems that we're pushing to solve with what we do and who we do it for. But you're right, structure's not bad, but I think maybe the word that describes it better is cookie cutter.
Yeah.
It's this diagnosis equals these certain things, not much creativity packed into the conversation. And then definitely some severe limitations with insurance on how many things can you work on inside a single visit, which that's what really turned our world upside down. Is like we could not go back into that model and function because we don't treat pain ever. It is not something we're asking questions about. Obviously, we want to see progress with people, but it's just not the right thing. It's not the right thing. This is my opinion, and take it for what it's worth. Uh, every physical therapy diagnosis is incorrect that anyone's ever been given. If it came from the doctor, it's definitely incorrect. And if the physical therapist gave it to them, it's at least partially incorrect. It's definitely very incomplete. Insurance creates some real problems around solving problems, root cause problems. And you hit the nail right on the head. This is so our clinical practice over the last 5 years, I would say 98% of people that we saw had already tried and failed physical therapy, chiropractics, meds, injections. We were at the end of the rope. And so we've been hearing that conversation almost daily for 5 years. So you're definitely onto something there.
Yeah, I assume that's probably where your clients come from when they're just not seeing the results anywhere else. I have also been lucky enough to work with an independent physical therapist who I think is much more like you and can really get into the subtle nuances
Sure.
and can explain, look, this is happening here, then we have to focus over here. So I'd love to hear more about your kind of diagnostic approach,
Sure.
what that looks like for somebody that's coming into your office. And I know you have a specific set of questions that you basically run your clients through in order to get down to that root cause. And I would really love to dive into that because I just don't think root cause in any form of health, if you're talking about traditional Western medicine, is very rarely being addressed. So I
No.
would love your take on that.
Yeah, sure. And the traditional medical model, it's they will base their diagnosis 90% on conversation, maybe 5% on presentation, and the other 5% on something else. It's different for the different sectors of healthcare, their examination. And so the problem with that becomes if you go in and tell your physician or your physical therapist, I have pain here. They're going to give you a diagnosis based on your symptoms. And in every case, pain is a symptom. And too many times, nobody's asking enough whys to get to the root cause. And I think there's very few who have made the distinction between the source of pain and the root cause of pain. So a source of pain would be disc herniation. And even the research shows a disc herniation rarely actually equals the pain that people are having. So that's why we get super frustrated with advanced imaging way too early in the process. But let's say disc herniation, source of pain. The root cause is, why did your disc herniate in the first place? And that requires looking at not the spine, but everything else outside the spine. We view the root cause of pain through movement. When we back up far enough and zoom out far enough and start to see how the body is knit together, how the biomechanics function from one joint to the next to create this thing we call functional movement. When we start zooming out and looking at movement as a whole and looking at compensation inside the entire context of functional movement, rather than how is this joint compensating by itself or maybe just above and below, then we can start to see really all anatomical internal structures that are experiencing breakdown are happening because of movement error. And this is outside of trauma. We don't count trauma in that. Somebody gets hit by a car. That's a different type of deal. We'll say this stuff online and people will ream us for it. And they're like, you can't to say everything's back to movement. Yeah, outside of trauma, we can. And so really, we don't ask a lot of questions because The truth is, the reasons why pain shows up in most cases is the same for everybody. The body can only do so many things when it's not working well, and almost all human frames are put together in the exact same way, barring any like anomalies. And so we've just seen it over and over and over that people have the same patterns of restriction in all of their joints, even in the absence of pain is not the indicator you have a problem. Pain is what's called a lagging indicator, which means you've had a problem going on for a while and now your body is asking you to make some changes so it doesn't get worse. That's all pain is a feedback loop. And once we started checking every joint and noticing, regardless of where pain was, people had the same patterns of restriction everywhere. And then we started analyzing their movement, and everybody who had joints that looked like this and this had movement patterns that looked like this and this. What we started doing was just, okay, how do we change the movement? And you can change movement and change pain immediately. And so then it was just finding, okay, how can we remove all the barriers to moving correctly so that we can change movement as fast as possible? You can change movement in the moment just with simple coaching and cueing. If you know what a good movement looks like, you can take a movement that doesn't look like that and start to make it look more like the target. And it becomes obvious that it's the right thing to do when people move like this and it hurts. And then you say, move like this. And they do that and it doesn't hurt. And so that was like our first like easy indicators, like people should be moving like this, not like that, because it doesn't hurt. And then it was just a matter of sorting out, okay, if we're going to move like this and have the whole movement look correct, not the partial movement look correct, what all joints do we need to change to be able to accomplish that? And so now I got to be honest with you. It was an accident that I started checking all the joints in the first place, because I came out of the corporate environment seeing anywhere from 2 to 4 patients an hour, getting maybe 15 minutes of hands-on with each person, just bang, bang all day long. And when I stepped out into the cash pay world, I started promising people 1 hour with the doc. And I quickly realized I didn't know how to fill an hour. Like I would do my manual therapy for twice as long and then still have 30 minutes where I typically wouldn't be working with someone. I was like, oh man, what am I going to do now? And so I just committed right then. I'm just going to check all their joints. Just my grand plan was if I check everything, probably there's nothing, I can't run out of things to do inside of an hour. But that's how we started noticing, wow, the person with shoulder pain or back pain or ankle pain, they all have restriction at the ankles, the knees, the hips, and the shoulders to varying degrees of stiffness or asymmetry, but they all had it. And then fast forward several years, this magic moment happened where we were always noticing at the ankles, people had leg length discrepancy. Have you ever heard of that? Sacroiliac joint dysfunction, hips out of alignment, leg length discrepancy. It's the same thing. It goes by many names. 100% of patients with pain had an asymmetry in the pelvis. This was very unique because I typically only check that for back pain. And I remember we had one client come in who was explicit, like my back hurts and my shoulder. And so I created symmetry in the pelvis first, and then I went straight back to the shoulder. So the last thing I always check is the shoulder, just the way it is. And so I had just checked the shoulder, then I went back to the pelvis, then right back to the shoulder, and the shoulder was normal. And I was like, what? And so I thought that was a fluke. And so I did it to the next 10 people that came through the door. It happened every single time. And then I got curious about the other joints, and it turned out that the ankles change, the hips change, the shoulders change, the spine changes. All the big prime movers in the body, they would all improve. They would all get worse. They would all, like, their asymmetry would switch. The changes weren't always what you would consider good, but what it revealed to us was that the first version we're getting is not the truth. If we don't bring the body back to this baseline at the centerpiece, then whatever we're seeing is some offshoot of that. And So it's just become our process now. Like there hasn't been a single client come through the door that hasn't received what we call the Keystone Reset, which is where we screen, create symmetry in the pelvis first, rescreen. Everything's different. It's a huge aha moment it was a real aha moment for me. And it was pretty cool to stumble on that. I'm not sure how many other people in the world are aware. So we're really trying to push it out. People need to know. A lot of people are stretching the wrong things. A lot of people are stretching things that don't even need to be stretched. And so you see a lot of this in the marketplace. You get these, oh, this looks like it's tight. We should stretch that. In our experience, the initial version of tightness or stiffness is some like fake version. And so once we started doing that, we started getting results in the first 1 or 2 visits. We're talking about total pain relief, 1 or 2 visits with everybody. And so it really changed the way we think about things. It changed the way that we can change movement, because now we can change movement with just one simple reset around the pelvis, and it automatically changes the way people move without coaching or cueing, just because they can. And so it's been really interesting. It's been super helpful. And so we're on a pretty hard mission to figure out how do we get this to the masses, tell them about it, make sure they have access to it. And more than anything, teach people how to take care of themselves. That's what we do. We are physical therapists. I hate to even say it almost. We just, we do it a lot differently. Our lens is just, the way we look at things is just much, much different. And when we look at root cause, the way people move is the root cause. And that's twofold. It can be they are moving a lot and moving incorrectly while they're moving, or it can be that they're pretty sedentary and their body gets like stiff and folded up into these positions they spend most of their time in, sitting. And then when they go to do movement, they've stacked up so much stress in all these places that now they're compensating in a lot of different areas, and that starts to accelerate the pain. When I first started working, I only worked with CrossFit athletes. We've expanded a lot since then, but they taught us a lot about movement, because we could see very directly how a stiff ankle showed up in the shoulder in an overhead squat. And so these were how we started making some of these bigger connections from far ends of the body. But what we really noticed was like, people are pretty good movers. Their technique isn't like super bad. They know what good movement should look like. They have barriers to doing it because their joints are stiff. And the reason their body really hurts is because they spend 23 hours a day in fetal position, essentially. They sleep on their side. They drive their car. They sit in a chair. They sit at the desk all day. They drive to the gym. They binge Netflix at night, all folded up in the seated position. And then they attempt 60 minutes of aggressive exercise in not fetal position and wonder why the body hurts and doesn't work right. And so we say it's a movement problem. It's either a lack of movement, which creates a movement problem, or it's a movement problem in that all the movement you are doing is forcing your body into positions that it doesn't like, and then creates the pain problem. And so that's how we work things back to movement always. It's a lifestyle. It's a lifestyle error that just comes from the American way of, we sit a lot. We're pretty sedentary. Even chronic exercisers are considered sedentary because they sit at a desk for 8-9 hours a day. There's probably a lot of people that don't know that statistic. Even if you exercise and you're in good shape, you're still considered sedentary if you work at a desk all day. That's just the way it is. But that's how we always bring things back to movement. But what that allows us to do is give people a lot of control over how they feel, which regular physical therapy does not. They do not hand you any control back. They hand you a piece of paper with a bunch of arbitrary exercises on it. And certainly doing those can help you. But movement can modulate pain, but we're not trying to modulate pain. We're trying to change the way you live your life so that pain is rare, not the norm.
There's so many thoughts that I have on everything you just said.
I probably talked for too long. I get carried away.
Oh, no, I love your excitement and your passion. The sedentary thing, I can relate to so much. I grew up in the restaurant industry or some type of customer service. So up until about a year and a half ago, I was on my feet for work for 5 to 10 hours a day. And since then, well, in that time, I was also going to physical therapy for an upper back issue, some things, and a hip issue. Some things got helped. The exercises did help to an extent. I wouldn't say that I was very good at follow through at home. So there's that. I'll take that. But in
Can
doing
we
some of
pause
those,
right there for a sec?
sure.
Because I think this is good for people to understand. How long was your home program? How long would it,
Um,
if you were to do the whole thing, hey, here's what you need to do and you go home, do this daily, how long?
Probably at least a half an hour.
Okay. Yeah, that's a pretty good chunk of time. Hard to find in the modern lifestyle. And when you did it, how drastic was the change in how you felt? Like I committed 30 minutes of my life to doing this thing, and the result was what?
The result was definitely that I felt stronger. I was building muscle where I hadn't had that before. But overall, I would say it just felt like more of a burden to do it than to not do it.
And now what was your goal? Was your goal pain relief or was your goal to get stronger?
Pain release or issue relief.
Sure. Yeah, whatever that looks like. You want to feel better.
Yeah. Yeah.
And so you notice one positive benefit of getting stronger, but it wasn't the positive benefit of why you were going there. And this is super important to understand is if you can't create the result that somebody's looking for in 15 minutes or less, you're not doing the right things. And nobody is going to give that much time out of their life to something that's not working for them. And so the thing, like, here's my big beef with home exercise programs. They're always too long. They're always arbitrary. They always have you do them in the clinic and then bill you for it, which is another ethical dilemma. But if it doesn't work the first time, it's not going to work the second or third or fourth or fifth or 10th or 50th. Like the things that work, they work immediately within minutes. And so home exercise programs where your pathway to success is like, just keep doing it and it'll get better. It's not true. I've not seen one of those ever in my last 10 years of working with people. And so it's important to understand, look, if you're going to get results, you got to figure out a way to do it for people really fast. So it fits into their lifestyle because people are busy or people are lazy. And it doesn't matter because people are people. And you're not going to work with anybody but people. Whether they're lazy or whether they're busy, you got to give them something that works fast that rewards them for doing the work.
Really quick, Holly B here. I just wanted to interrupt the podcast to ask you for a quick favor. Can you take just a moment to like and subscribe to this podcast on whatever platform you are listening in on? It makes a world of a difference. And the reach of this podcast, it takes like literally under 10 seconds. So go do that right now. Thank you so much. I really appreciate it. And now back to the episode.
The longer you have somebody do work that doesn't reward them with what they want, the more likely they are to stop doing it.
Yeah,
So
I 100% agree. And I definitely experienced that. But I wasn't willing to give up. Like, I only had so much time, right? And I wasn't willing to give up my morning yoga, even though I couldn't do it as well because I was having issues, right?
yes, yeah.
So I couldn't get it to fit into that in addition to. And then the other issue that happened is that in introducing a certain exercise that they gave me, I ended up actually, and I didn't realize it when it happened, but I actually injured my lower back.
Mm.
And I had never had lower back issues before. And I've learned some things that help it. But what I've really learned, because since doing that, I've been so much more sedentary because I'm not in the industry anymore and on my feet all the time.
Sure.
Sitting exacerbates it so much.
Mm-hmm.
And the way I sit
Yeah.
can either help it or hurt it.
Mm-hmm.
And that took a long time to really figure out.
Yeah. Yeah. And nothing wrong with that necessarily because you're just collecting data on what's better and what's less good. And so you can, that is something that can be used to help you navigate what's going on. but you're experiencing now the regular life of an American where the body craves movement. It's designed to move. It's not designed to sit and be stagnant. There's so many things that happen inside the body when it moves. Blood flow, lymph flow, muscle building. There's so many
Oxygen flow.
yeah,
Yeah, oxygen.
it's the amount of things that happen when your body's moving is pretty thick, according to the research. And your tissues are just layers and layers and layers on top of layers. You know what I mean? You got skin, then you got fascia, then you got muscle belly, which is just layers of muscle fibers, all with fascia wrapped around each one, right down to the bony layers. And what happens is when you sit, you know how they make plywood? You ever seen that? They take all these little layers of wood and these little chips of wood and they stack them and then they press them together until it forms a board. And that's what's happening inside your body. You're slowly turning your hips and hamstrings and your back into plywood. You just compress the layers together until they no longer slide independently of one another. So you get so much stiffness because everything is just matted down and stuck together. And that creates a movement problem. It's a local movement problem because the tissue right there in the area can't move like it should when you are moving. It's a global movement problem because that stiffness is going to be forced somewhere else once you get up and actually get moving. And so it's a recipe. Sitting, you ever see the book, Sitting is the New Smoking?
Yeah, I've seen it.
It might as well be.
And I'm feeling it. I'm feeling it. And I'm learning to get up every hour, move around, do mobility stuff, and intersperse that throughout my day to make it better.
Yep.
And that helps. But when you're working with somebody who is in this position, has that job that they can't get out of, and maybe they love it, and but they're sitting all day, how do you start to work with that? They got to clock in and clock out. They
True.
don't have the option to get up and dance for 5 minutes every hour.
Yeah, for sure. And that's a really great question because this is exactly what we help people figure out. Is there's always opportunity to move more during the day. We're not going to ignore that, but we're not trying to make that the solution either because it's like of all the things, it's probably the least practical. Like peeling yourself. There's a value to sitting down, getting in the zone and not moving for hours in terms of productivity. You just can't ignore that. Look across the lifespan of just about any working culture as far back as you want to go. And you're going to see documented images of when people are doing work, they're here. They're folded up, squatted down, bent over. It's just the way it is. And there's nothing wrong with that. The problem is that people, one, the chair is a huge problem because it just puts you right in the middle. So you're not even challenging the lower ends of range of motion. But the problem is that people don't have a strategy to unglue their body once it's over. And so they just keep stacking stiffness every single day until they wake up one day and they're like, man, I feel like my whole body is in a straitjacket. It's stiff. It can't move. I wake up that way, go to sleep that way. And they're noticing physical decline in the way they feel and function as a result of long-term sitting. And so what we actually do is, number one, we always start with goals. And I'm not talking about your short-term goals and long-term goals your therapist will put in there about patient will reach within functional limits of XYZ. I'm talking about what do you want to do 3 to 6 months from now? What do you want to be doing that you're not doing now or that you're doing right now but enjoying it less because of the way you feel? Okay, great. And then very next question, okay, if you were able to do that, just as you described in the next 3 to 6 months, what would that do for your life? Because everybody wants to get rid of pain. Nobody wants to live with it. But not everybody has a compelling reason for their body to figure it out. You know what I mean? So if you start with a goal and you figure out like, hey, I want to be able to do this 6 months from now. And doing that will allow me to feel this way or participate in this certain thing or re-engage with this group of people that's really close to me in some way. Now you're giving like your body a compelling reason to stay in the deal because like resolving completely can be challenging. We've demystified a lot of it, but it doesn't mean there's not work to be done. And people are lazy and people are busy. So we got to have a reason to push through when you hit a barrier or a roadblock or a hurdle or whatever the case may be, and enough of a compelling reason to just stay committed to the process. So we always start with goals. We always start with those two questions. Then we start with a screen, full body screen. We start at the ankles. We work our way up and figure out, okay, we zoomed out. What are the barriers to keeping you from moving well so you can feel well? And then we just start chipping away. For the chronic sitter, so that's one of our programs, is okay, either before you start work, you need to do 1, 2, 3, or as soon as you get home, 1, 2, 3. Break your body out of the position, bring it back to baseline. Just do a reset, first thing or last thing, so that you're not stacking this over and over again. And our favorite place to put our programs is at the gym, in front of a workout. You can't restore movement without changing your mobility first. And you can't change your mobility just by trying to move into those positions that aren't available. You have to change the underlying operating system so you can change. It's your anatomy is the hardware and movement is the software. You can't change the software if the hardware doesn't support the software. Like your iPhone, it eventually runs out of updates. You know what I mean? It's not going to take on new software because the hardware can't support it. That's your body. If your body, you don't change the hardware, you will not change the software. So we always start with the joint. If you loosen the joint first, the muscles will just unlock. If you create new space in a joint to move better, the muscles just follow it. Then we go for the muscle second. So many people we talk to, they go for the muscle first, and the muscle can't go farther than the joint will allow it to go. And so you end up with minimal results, marginal results, temporary results, and they always come in saying, man, I've been doing these stretches for 6 months. I feel like I'm starting over every day. And it's okay. Doing the same things over and over again and expecting a different result is insanity. And they would all agree. And so we just show them a new pathway where start with the joint first. We teach people how to do this stuff to themselves. They don't need to rely on us to make it happen for them. And then we do the muscle second, because now you can get a more effective stretch out of a muscle. Stretching a muscle also shows the brain, hey, look, I can go further. I can get in a new position. Also, it's not painful, so it must be okay to be here. And now you can turn that into usable information through movement. Like people are already going to the gym to do movement. So now we just need to do loosen and lengthen. And then we just need to do your movement very intentionally. You need to use up 1 and 2 inside of your 3 so that you get to keep it. Because if you don't use it, you lose it. It's a great principle. And so many people stretch or maybe even mobilize themselves and do it correctly, but then they don't put it in the context of functional movement, and the body will just discard it. Because your brain does not store mobility and it does not store stretching, and it stores movement. And if you don't on purpose use the new mobility to create new movement frequently and consistently and create the new pattern in your brain, your body will always forget what you did because it's not useful to it yet. But as soon as you make it useful, now it sticks. It becomes sticky. You get a 2-step forward, 1 step back type of deal with your mobility. And if you do 2 steps forwards and 1 step back, a lot of times you get a lot of steps forwards. And that's what our clients' experience is. They'll walk out of the clinic with a lot of benefit. They'll do their homework and get a lot of benefit. Each time they come back to it, they've lost a bit, but not all of it. So just a commitment for 7 days totally changes the way they feel. And then roll that out for 7 months, roll it out for 7 years. It's the 1 degree change traveled over a very long distance. Your destination is totally different. And that's really what we're after, is giving people tools in their toolbox so that they can shift just 1 degree. And if we can just make it easy enough for them to do it over a long enough period of time, we change the trajectory of their 70s and their 80s and their 90s to something totally different than it would have been if we had left them right where they were when they first came to us.
I definitely talk about the 1 degree difference all the time with my clients. It's so important to understand that just those tiny little changes, as long as you're consistent with them,
Yeah.
will make a huge difference in a month, in a year, in 10 years. If you can just stick with it and get it into your habit, into your routine.
Yeah.
Can you talk a little bit more about, I've always loved yoga, right? And you're talking about stretching, but you're talking about like the joints and the aspect of being able to mobilize the joints, maybe to make the yoga more effective or easier, or this whatever type of stretching. Can
Yeah.
you dive into that a little bit more?
Yeah, I'm glad you picked up on that because truthfully, yogis are always the most challenging to work with. And the reason for that is because yoga is going to put your body at an end range that for most people who pick up yoga in their 30s or 40s don't have. So they're going to be putting a lot of like compensation stress on other joints. But just for instance, like Cobra, it seems like a super basic, simple position. But the truth is, if the front of your hips are locked up because you sit all day, rather than Cobra being shared from the tip of your toes up to your chin, it's all happening right in the lower back. So all your little joints in the lumbar spine are just getting crunched together. You're getting a hinge at the low back rather than this nice banana shape. Functionally, it doesn't look that much different. Functionally, maybe early on, it doesn't feel that much different. But this is where yoga becomes challenging. And obviously, there are lots of different types of yoga, and I don't know hardly anything about most of them. So I got a limited scope here. Things like flow yoga, which is more movement based, it's not as much at end range versus more traditional yoga. Get in this position and stay there. It can be very stressful if your joints don't have prerequisite mobility to do that. And so we see yogis coming in with a lot of pain. And it's difficult to get rid of because they won't quit yoga. And so it's a challenge. We're always up for a challenge. But the other thing about yoga, it's also not super functional. I'm not against yoga. Anybody who has a movement practice, I'm all for it. And we're going to help them do that to the best of their ability and do it pain free. But we are huge proponents of functional, like things that are going to show up in your daily life. This is why we really love squats, deadlifts, and overhead press, is because those happen every day. Whether you're doing it with a barbell or not, you're squatting down, you're bending over to pick stuff up, and you're pushing stuff over your head. It's just natural. And so having the mobility to do that and do it well, creating structure in the gym to do that with really great techniques so it transfers into your daily life. And the stronger you are, the harder it is to get hurt. That's just the way it is. So we're huge proponents for building strength and muscle mass through functional movement. Functional movement helps us restore joint mobility. It'd be difficult to restore joint range of motion through yoga just because the body doesn't necessarily store information that way. It stores it through movement patterns that are frequent and consistent versus just something that you're doing that may be challenging. You know what I mean? Did that answer your
Yeah.
question?
Yeah. Yeah.
Okay.
Absolutely. It gives me a lot to think about for
Yeah.
sure.
Yeah.
Because that's been the one thing that I consistently stick with is even if it's just a 10-minute yoga stretch in the morning,
Sure.
it makes me feel like I can move and handle my day.
Yeah.
But I don't know how much it's strength building for me. I don't know how much it's always helping my joints. So,
Sure. Yeah.
yeah.
It's definitely there to consider for sure. We're not saying anything negative about yoga. But we do have a ton of good data on like functional strength building, adding lean muscle mass to the frame. These are all huge metrics for longevity. If you want to get older and be okay about it, those are the things that research can point to. Is look, you want to add years to your life and life to those years. Functional mobility and functional strength are the pathway combined
Yeah.
together. Yeah.
Yeah. And that can in turn support a yoga program. Like they can help each other. Yeah.
Yes, 100%. I would view, so the way we kind of view things is like a pyramid. We call this the functional pyramid, where the base is functional mobility. Now you have to start with, okay, what's my lifestyle including, and how much functional mobility do I need to have to be able to do these things compensation free? So that's the base of the triangle. The middle section is functional strength, which is, okay, my life requirements are here. How much strength would I need in my body to actually exceed that and create this buffer? And we view those two as capacity. As your functional capacity, your ability to move compensation free and your ability to be stronger than anything your daily life is going to require. The tip of the pyramid is what we consider skill, which skill could be a lot of things. Skill could be weightlifting itself. It could be hiking. It could be biking. It could be triathlons. It could be yoga. And so when we look at yoga as a skill, it's the fun thing. It's the thing you want to be doing. Okay, how much functional mobility do I need to have to do yoga compensation free? And how much strength do I need to have to be able to tolerate the stress of yoga and not even get close to my threshold of creating problems? And it just creates structure around, okay, this is what I need. This is how I need to get it. These are the types of training exercises I need to do to be able to support my joints and my muscles in a way that can tolerate yoga. And what we see is that when we identify the functional mobility limitations people have, we can create boundaries around their movement. We can keep it confined into this area which doesn't compensate, and they can build a lot of strength inside of that. And they can do a lot of yoga inside of that. It only becomes problematic when people start stepping out of bounds over and over. They're blowing past a mobility limitation. They're like I don't believe in overtraining in the traditional sense, but I believe people do more than what their physical strength is totally capable of, and that can create problems. And we see better mobility as a hedge against less strength, and we see better strength as a hedge against less mobility. But as long as we're talking about it, we're just going to try to max out both.
So as we get to the end of our conversation here, I do want to transition this talk into, because I know probably the most people that you work with are athletes or chronic pain, but how many of those people that you work with actually are in the space of autoimmunity and things like maybe rheumatoid arthritis or lupus or fibromyalgia, things like that? Chronic pain and inflammation in the joints goes hand in hand with that diagnosis.
Sure.
I know that's a much different issue than what a traditional physio approach to other things looks like, but can you still work with them? Can you still make recommendations when somebody like that really is sedentary, not because necessarily they want to be, but because they're in so much pain and in so much fatigue that they don't have the energy to do these exercises and things to strengthen them? Hey, I just wanted to jump in here and interrupt the program for just a hot minute. You know that I'm so passionate about this podcast, but what I'm also really passionate about is helping women with lupus minimize their symptoms, boost their energy so that they can indulge in life again. So if you are a woman who is struggling with lupus, who is sick and tired of being sick and tired, who's struggling to manage your flares, if you're finding that your lupus symptoms are just really getting in the way of you being able to live your life the way you want to, I feel you. I've been there myself and I felt the same way. And what I've found is that there are a certain set of health fundamentals that, once applied, will support you in your foundational health. They will support you in building and maintaining that energy, minimizing flares, and allowing you to, again, indulge in life and follow your passions. So if that is something that you are interested in creating for yourself, let's jump on a call together. I will walk you through the process that I use with my clients to get them from sick and tired to strong foundation of health by implementing my Health Bridge protocol. If this is something you're interested in chatting more about, I would love to talk to you. Apply for a free clarity call with me, and I look forward to getting to know you soon. And now back to the episode.
Sure. Yeah. That's a good question. And I would say, one, a lot of people always think we do work with a lot of athletes, and we actually don't. We're very gen pop. Just the way that we treat them more like we would an athlete. And there's a lot of value in that for a lot of different reasons. We actually partner with corporations. And so our population is probably just a microcosm of the greater population. What is the percentage of people in America that has an autoimmune disease? And then just extrapolate that percentage down into smaller groups of people. And that's probably a pretty good representation for how many we see. But really, NRG Physio Co., we help employers reduce wasteful spending inside of their health plan on musculoskeletal health problems. Certainly, some of the autoimmune diseases fit into that. But I only say that to say we're just working with regular people that work for somebody else. You know what I mean? We're not in the CrossFit gyms anymore. That was a great place for me to start. I got to learn a lot and made it easy to market and find people. But we've moved on since then. We're serving corporate partners. It gives us access to so many more people that we can help. And we get to save people money instead of just costing them money. So it's a win for everybody. But to answer the question more specifically about autoimmune is certainly there's a level of control you can have over any autoimmune disease through traditional channels of medicine. We may not always agree with all of them. We might think there are better solutions out there, but that's besides the point. At the end of the day, we want to give people a perspective on pain and self-care that they've not had. We want to change what they believe about their body, because every action you take is riding on the back of a belief that you have. And if you can change the belief, if you can change the decision you've made at the top, you can change everything else that follows. And so we want to do things that help people better understand, how does the body work? What does it really mean when you have pain? And we want to do that as a way to remove uncertainty from their life and from whatever process they're using to navigate their problem. Because if you can remove uncertainty and start to hand people control, you remove fear and you allow them to take action steps with higher levels of confidence. And that will allow them that 1 degree shift, if traveled over long enough, to actually create resilience in their life through whatever their daily practice is. And so we're not trying to say, hey, we have the solution for autoimmune anything. And there's a whole host of these things. And we do recognize that there's some unique challenges inside the autoimmune space, like widespread pain and low energy, that is a hurdle that other people don't have, at least not for the same reason. But what we are trying to say is, in a situation where you've been robbed of the certain levels of control that you have, here are the things that we can do that you can control. And when you start taking actions based on things that you are certain about and that you do have control, you can start to see real change in your life rather than being stuck with it or not knowing what's next, or understanding how, okay, maybe my pain is not necessarily from rheumatoid or fibromyalgia as much as it is, maybe I had these things, but the way I am moving creates greater levels of problems inside of my body. And so what we do is we give people certainty around the way that they move. We give them little bite-sized ways to introduce a movement, remove stress from their body, ultimately so we can empower them to make decisions for themselves that they probably weren't making previously. There's no secret sauce. You know what I mean? If you have an autoimmune disease, you need to be exercising just like everybody else. We understand that's challenging, but at the same time, it might be more challenging for you, but you probably have more problems for the same reasons everybody else does. And that's that you're missing mobility in key joints and you're not moving super well. Forget moving often. When you move, you're not doing it very well. And that creates problems no matter who you are. You've just got the deck stacked against you in a different way than somebody else. And so when we work with Parkinson's, fibromyalgia, rheumatoid, MS, the solutions are the same, but it all comes down to changing what people believe about themselves and what's possible, giving them the control back so they can start making positive actions that are leading somewhere. Because the problem with exercise is not that it won't lead somewhere. It's that exercising just to exercise will get people in the boat of pain if they don't do it very well. And so that's always our problem we're trying to fix is, look, it's not that movement's the problem. It's just the way that you're doing it is a problem. We say there's no bad movements. There's only bad movers. And once you recognize, hey, I fall into that category, now you have complete control to change the way you move. If you know what to do and when to do it and how to do it, okay, people just need tools. People need tools and they need education and they need to know how to take care of themselves. And we've always thought if you give people the right tools and information that they need, that they can change the way they feel all on their own. We do it in the clinic and it's fast. We do it online where we do it with people and it's a little slower, not much, but ultimately we're just teaching people how to take care of themselves. How do you work your own trigger points in soft tissue? How do you work your own joints? How do you recognize good movement from less good movement? And when you recognize it's less good, what tool do you pull out of your toolbox to change it? And if you can't change it within a couple of minutes, how do you change your movement for that day so you can get a good workout in, a good stimulus in, but you don't do it in a way that wrecks your body during or after? It's not rocket science. It's really not. Like our concepts are simple. Nothing's so complex that people can't understand. But for whatever reason, it's just drastically different than the message most people are hearing. And sometimes that's hard enough in itself. A lot of our clients come in and they're so relieved to have made progress within one visit. And then they come back, man, I'm just so frustrated. I'm like, oh no, what's happening? I'm always worried somebody's going to come back and be like, oh no. And they're like, man, I just wasted so much time and money before I got here. It's like, yeah, sorry about that. But better to cut that off right now and continue with a better path forward than to continue wasting time. And they would agree. And it's the autoimmune deal. It's challenging. It really is. But ultimately, we're trying to coach. We're not trying to be people's physical therapists. That can only take you so far. What we're really looking to do is change the way people live their lives, because that is the pathway to pain freedom. Pain relief is great. We think everybody should have it, but ultimately it's not reality to be painless 24/7, 365. It's just not. Pain is the most valuable tool your body probably has in telling you, like, it's not going to tell you how to course correct, but it is going to tell you that you need to course correct. And so teaching people how to use pain to navigate their way out of it is an essential tool. It's a life skill like deadlift and swimming. But ultimately, helping people take control back over their physical health in a way that makes real progress and makes real sense, and giving them everything they need. So when they do have pain, they take the first crack at it. Okay, I know what this means. I know that I can do 1, 2, and 3 as a start, rather than just the first call being the doc. So we want, who do I go see to be their next best choice, not the only choice they have. And you can only do that if you really take the time to understand what do people want, teach them what is the truth about the body and what pain means. People don't even know what pain is. You say, what's pain? It's like, it's an unpleasant experience. Yeah, it is. But that's not what it is. It's your indicator that you need to change something. And if you still have pain, it just means you hadn't made the right changes yet. So it doesn't mean you're going to have it forever. It just means you need to keep looking. We figured out what all stones we need to look under for the most part to help people make a lot of results quickly. But once you just teach people that and then start just filling their toolbox with things that are super practical and easy and they work really fast and they take minutes instead of 30, most of our programs are 10 minutes or less. Some creep up to 15, but that's still way better than 30 or 45. And once we started doing that, we really started seeing patients empowered to do that. It's bad for business, to be honest with you. Like people don't come and then come back. They'll stop by and say, hey, because they enjoyed their time here, but they don't have problems for us to solve anymore. And so like there's no recurring patients coming back in the door. It's very rare, which is annoying from a business perspective, but it's exactly what we're setting out to do. And so we can't be mad about it because we told them when they came in, look, when you leave here, you'll never need to come back unless you just want to. And so far that's been true. And we're proud of that. And we're happy to be serving larger quantities of people through our employer health programs and just spreading the word about what's possible with your own health and how to take care of yourself.
I appreciate your approach so much because it hits on so many levels of what I believe and how I coach with my lupus and autoimmune clients. Getting simplicity, getting simplicity in the routine is key. And mindset is like in my personal health experience was the first thing that really made a huge difference in how I experienced health and seeing it actually shift because my mindset shifted. That was like mind blowing when that happened for me. And so I always start with that with my clients. And once we can get that mindset wrapped around and viewing your health in a different way, viewing, like you said, the pain is an indicator of things that need to shift. It's not like when I look at autoimmune, you probably had a lot of smaller indications along the way leading up to that diagnosis before your body finally was just like, I need to punch you in the face now to get you to listen to me.
Yep. You're exactly right.
Yeah. And so even though it feels like it happened overnight, sometimes it was probably years in the making. So getting people on the mindset shift, getting them to, like you said, looking back at over time, you can see like the literal paint on the walls of people sitting down in that crunched position to work, right?
Yep.
Getting back to more of the essence of how human bodies are supposed to live and interact in the environment. Doesn't mean we can't still have technology, doesn't mean we can't still have our 9 to 5s, but we can start incorporating some of those aspects back into life today and remember that we're still human. Remember that we aren't a computer like our desktop where we can just turn it on, turn it off, and hit buttons and make it do things. Like we have to nourish it and support it and help it move in the way it's supposed to move. And those simple things can lead to huge shifts in health.
Oh yeah. The payout.
Even in autoimmune, right?
Yeah. Autoimmune is one of those things. It's like, it's just the simmer. It's always simmering underneath our lifestyle choices, movement, quality of food, quality of sleep, quality of recovery. Those are the things that if you ignore, that's the lighter fluid. You really want to get your autoimmune disease ramped up, eat a bunch of sugar and processed food, sleep 2 hours a night, and sit in a chair all day. That'll get you really going. But at the same token, it's true. If you make small shifts in all of those, the payout is dramatic. Like the world does not make it easy to do these things. That's why not biting off more than you can chew is like one of the best things you can do. Start small. You can always add more later. But most people, they add too much and then give up everything. Say, let's just do one tiny thing really well. Let's see what that turns into over the next 10 years. And all good. We do mindset mastery, mobility mastery, movement mastery. Those are our 3 things we're helping.
Love it.
Yeah. And we do it with the 1 degree. I don't know if you caught that in there.
Oh, nice. No, I didn't see that.
Yeah.
Love it.
We buried it in there.
Well, Dr. Chad, where can people find you if they want to explore what you have to offer?
Yeah, I would say for anybody listening, if you work for an employer who has a decent amount of employees, we could partner. That'd get you some free Dr. Chad and free energy. We're always looking for new partnerships so we can help a lot of people take control of their physical health. And otherwise, you can find me online at Dr. Chad R. Nowlin. That's on Instagram. And that's dr.chad R. Nowlin. Online, NRG Physio, PHYSIO.co, not .com, .co. And that gives you a lot of information about what we do and how we do things. And if you just want to, you can DM us on Instagram if you have questions, or if you just want to give us a ring, 317-707-9966. Me or Marcy will answer that. Make sure you get anything you need.
Awesome. Thank you so much for such a really valuable, in-depth conversation that I think can help anybody listening, no matter what it is you're going through physically.
Sure. Absolutely. It's been great being here.
Such a great conversation with Dr. Chad. There's so many valuable points within that entire conversation. One thing that I want to touch back on is that it really is a simple explanation, right? The way people move is the root cause to the pain in the body. So if we can just simplify things from all these medications, all these different specialists, all these different doctors, surgeries, if we can just take a step back in a higher level view and look at what am I doing that doesn't translate well in the body? Am I moving wrong? Am I sitting wrong? Am I too stagnant throughout the day? Am I too sedentary? We have to understand that things with our health don't happen in a vacuum, right? They don't happen in a little box. Something's going on with your knee. It's not just about fixing your knee. It relates to the rest of your body. It is a part of the rest of your body. If you're having back pain, what else is going on, right? And I think so much of it's getting a little bit better now, but so much of the Western approach is just focusing in on that one specific area and how do we affect that one specific area? What pain reducing shot can we give? What surgery will fix that for you? If we can just step back and take that wider view and take more responsibility with the way we've been living our life, and I'm not putting any blame there, we're just human. We get into routines, we get into movement patterns or non-movement patterns, we get into eating certain things, and it's only with hindsight often that we can take a look and say, oh, now I can connect the dots between what I have been doing for the last month, year, 10 years. I can see how that now has sort of snowballed into where I am today. And so just to reiterate that finding simplicity and finding that high level view of your health, whether it's with your autoimmune disease or anything else that you're going through, that's where we need to start. That's where we're going to find the root cause. And when we can find information, when we can find coaches, practitioners, doctors that can take that view with you and walk you through that high level view and help you simplify the whole scenario instead of complicating it for you, that's when you know you've found a good practitioner, a good coach, a good person to work with that has your back and wants to help you. Dr. Chad is such a great and valuable resource in this space, and I highly encourage you to reach out to him, whether it's for help on an individual level or whether, as he said, you work inside of a larger company that offers healthcare. He is always looking for opportunities to partner with employers to create a better health and wellness program for the employees. So you may be able to get benefits that way and work with Dr. Chad and his team. So please reach out to him. All of his information is in the show notes. If you are struggling with lupus, with other autoimmune diseases, or you're in that fuzzy space of maybe I do, maybe I don't, and you want to take that higher level view and you want to make those 1-degree shifts in your life to create a different outcome for you over the next few months, over the next few years, over the span of the rest of your lifetime, please reach out to me. I would be honored to help you along that journey. Thank you so much for listening, and we'll see you on the next episode of the Health Bridge podcast.